In this episode of Coding Corner, we are going to talk about the mandatory OASIS reporting for all payers that begins in 2025 and what agencies can do to be ready for the switch. Pause what you're doing, unless you're driving, of course, and hit the subscribe button so that you can get this and further episodes at your fingertips when they come out.
What can you tell our viewers about the changes coming to OASIS and coding for 2025?
Well, Hannah, as we get ready for the holidays this season, January 2025 is also coming fast, along with the following updates in the coding and OASIS industry. So one of the updates is mandatory OASIS reporting for all payers. Beginning January 2025, certified home health agencies will begin completing and transmitting OASIS data for 100% of their patients, not just patients with Medicare, Medicare Advantage, or skilled Medicaid. All payers will be included in outcome calculations beginning July 1st, 2025. There's a transitional time frame before this happens from January 1st to June 30th, 2025. At this point, agencies may voluntarily submit the OASIS for their non-Medicare patients. However, beginning July 1st, 2025, submission becomes mandatory. Home health agencies must complete and transmit OASIS assessments for all of their patients, regardless of their payer type. Keep in mind, the outcomes for all payers will factor into star ratings and value-based purchasing quality measures.
Tina, why the change to all payers?
This will align home health agencies with skilled nursing facilities that already report this patient data for all payer types. This allows for fair comparisons between home health agencies and skilled nursing facilities. It also provides a more accurate and fair comparison across the post-acute care continuum.
What should agencies do now before 2025?
They can do several things. Some of those are providing comprehensive OASIS training to all their clinical staff. They can educate field staff on the new requirements and provide training to improve documentation accuracy. They can be sure that each clinician is completing a thorough and accurate OASIS assessment for every patient, regardless of their insurance coverage or payer type. They can focus on improving outcomes that drive quality measures and optimize PDGM case mix weight. They can begin voluntary OASIS reporting for non-Medicare patients during the transitional time period instead of waiting for the mandatory time, which is July 1st. They can also consider partnering with a reputable OASIS review outsourcing company such as HealthRev Partners. This new reporting requirement isn't merely about compliance, it's also an opportunity for agencies to flourish. Agencies that take proactive measures to improve their processes and results will be better positioned for future success. Value-based purchasing will be critically important going into the new year, as the discharge function score will be calculated based on the scoring of the GG items, which will drive agency outcomes and star ratings.